seen. Better to be seen than viewed.
Certainly.
All right. Looks like we are live. Welcome to week 8. Hard to believe, 8 weeks. This would be meeting number 50 of the regional report out calls, if you can believe that. And it is February 2nd, Groundhog Day. Puxatawny Phil saw a shadow, so we have 6 more weeks of winter. If you need an update on that. But here we are in the KC Metro region where we have been every Tuesday. Important note, I'll make this again at the end of the call, but we are switching to a every other week format from here on out. So our next meeting will be February 16th at this time. So more reason than ever to go to our website, covid.ks.gov/report-outs to sign up to get the email. So you don't necessarily have to remember that this call is in 2 weeks. It'll show up in your inbox with the dashboard and the update. And then we'll be again on March 2nd after that. So go on to sign up, covid.ks.gov/report-outs. We're doing that because generally the numbers and updates have been good, going in the right direction. I think we'll hear that again today. And we just want to make sure we have this tool handy in case numbers start going the other way. But right now we've got a good story to tell. And I'll start with our dashboard. Oh, Megan, can you make me the host, please? All right, so we'll start with our dashboard here. All right, as you can see, still having some critical staffing shortages, not as bad as it was. Still something though, as we're rolling through vaccines in the hospitals, we want to continue to be aware of. Now look at this number of COVID patients. Last week we were at 644. You gotta remember, 3 weeks ago we were at 863 hospitalized confirmed or suspected COVID patients. And I'm hearing widely across the state from hospitals, a lot of hospitals are 40 or 50% COVID patients from the peak of where they were in early December. And so that's good. Here in the ICU, 155 last week, 125 COVID patients in the ICU. And adult staffed ICU beds available. We were 111 last week, now back up to 142 or 24% of the system available. That's good news. Then you can see here the case count continues in the right direction, leveling off a little bit. But I will say, just a quick update for the state. I heard this on a call earlier today from Secretary of Health. At our peak, we were about 2,500 new cases a day as a state, and we're more recently at 650 new cases per day. And our positivity rate as a state was 6.44%, which is the lowest I've seen since the end of September. So that's very good news. Kansas City Metro was at 5.5% positivity rate, getting really close to being back, at least in the measure I get, to a blue dot, which is a good dot that you want to be. So you can see we dropped now last couple of weeks in the 2,900 area there on the number of cases. And you can see the percent of the population that is tested positive for each of these counties. Again, these dashboards are attached to the email. While I have the screen, I'm going to flip over to the vaccine website. If you remember, kansasvaccine.gov, you can look at the data here provided. Continue to vaccinate more Kansans. We're at 6.4%, which is a good increase. 229 shots in arm, 229,000 shots in arms, which this is again lagging based on the way that we're entering data, but at least 185,000 people have gotten the first round of the vaccine, and there's continuing to be distributed. Again, on here you can see Pfizer versus vaccine, age, gender, shots per week, and then how much is going to each county, per week here. So Johnson, for example, 5,800 shots this last week. Continues to be a supply issue on the vaccine side, not as much a distribution issue, and it's going to take a while to get through phase 2. So with that, I'll stop sharing my screen and we'll turn it over to the real pros here. I can read numbers like a good reader of numbers. But these are the guys making the difference. So let me pass it over to Steve Mayhew, Johnson County Health Department, to give us an update on what's going on in his world.
Yeah, thanks, John. So as you pointed out, the numbers in terms of percent positivity and case counts and incidence rates and everything that we've been following are still headed in the right direction. I'll also note that one thing that I've heard this week, and it's been sort of a trend we've been watching, is testing is down. And so it's not to say that these numbers, seeing all those numbers negative, if one of those numbers was, going in the wrong direction, we might wonder if the decrease in testing was contributing to that. We can't say for sure if that is the case, but what I will say just anecdotally, we had one site that was doing about 500 tests a day. And they've got 26 appointments booked for tomorrow. Here at our health department, we've been doing about 300 a day, and have dropped that to about 120 to 150. And so, there's still testing out there, but there is some concern around the metro that the number, so obviously you want testing high enough so that you can keep a good view of what the disease looks like in the community. And when the testing drops off too much, COVID is moving around without us knowing it. And so, again, the numbers still look really good, and we want that to be the case, but we're working on trying to bolster testing and get the public interest in testing back up so that we can ensure that the numbers that we have reflect, what we think is going on. And so, again, not trying to signal any alarm bells or anything, just putting that out there that, all those numbers are down, testing is down as well. And you may see a concerted effort from your local health departments trying to drive that a bit higher. Vaccine is the other big thing that we've been working on. John went through what the counties are receiving. Here in Johnson County, we are getting a good amount of vaccine. Obviously, we hope to get more soon so we can get out into the community. But we've started actually distributing some of that vaccine to hospitals. And so, we don't expect one department or one organization to give out all the vaccine that we receive as a county. And with the state transitioning to utilizing local health departments as sort of those distribution hubs, we've started turning some of that vaccine around within a day or two to hospitals. And so I think in the past week or so, we've given about 6,000 doses of vaccine to hospitals, and we're looking to give, 4,000 to 6,000 more. And that's primarily in Johnson County, but also to KU as well. And so we're working through those processes, trying to leverage the resources available in the community to get vaccine into arms as quickly as possible. And so that's that's a shift from last week, but that's what we've been working on.
Steve, I appreciate that. Let me clarify too. So when you're giving them to hospitals, that's not necessarily for hospital workers. That's for them to be working through the phase 2 population.
Absolutely. And a lot of the hospitals are reaching out to their the patients that they have that are 65 plus. And then we're working on, we know there's a number of people who are not affiliated with a healthcare system. And so, we at the county level will still be offering our vaccination clinics as well. We'll remain one of those providers. We're just looking to share the love.
Yeah. So would you say, is there a good partnership between, there's 3 counties represented on this call. Are you guys all working together with the hospitals there on this? Is that what's going on in the KC Metro?
So I saw that you had Leavenworth on there. They get, I think, 1,100 doses a week. They may be sharing with hospitals, but when you start sharing 1,000 doses, it doesn't get you very far. And so we've been receiving about 6,800 and are able to, there's just more to go around right now in Johnson County. And so I think Wyandotte is getting 1,000 to 2,000 doses a week as well, which again, they've got a very large clinic set up that they can do that in a day or two. And so I know that's in the planning, but we're not at the point now where we have enough vaccine for them to share with everyone.
No, that's great. I just was curious. There's not obviously a right way to do this, or a one right way to do this. Let me say that.
Sure.
So it's great to hear about the partnership and what you're doing in Johnson County and how you're working together to get to the most people that we can. But I'd guess there's 100,000 plus in the Johnson County area that would qualify in phase 2.
I believe that we have over 95,000 people who are just over the age of 65. And so I put that number closer to 200,000.
Yeah. And you're doing that on 6,800 shots a week. So again, I just want to make the point to everybody, this is a supply side issue. Well, power went out in Kansas City. Need to clap, get the clapper going.
I'll get that.
And we just cannot state that enough. I talk to people out in the business community, and it's just a lot to understand. It seems like it's a distribution deal that we have it sitting there and we're just not getting it in arms fast enough. But in reality, it's just they're getting it out as fast as supply comes. It's going to be a long few months to get through phase 2. Let me kick it over to our friends on the hospital side to get their perspective while Steve finds the lights.
Yeah. So Bryant, you wanna start us off, and then I'll jump in?
Yeah, a couple of things. I think I'll start with some recent information that was shared from the Missouri Department of Health and the Missouri Hospital Association. And I know everybody's going, we're talking about Kansas, why do I care? Well, you care because of the impact on the metropolitan area, generally speaking. And Missouri has taken a much different approach to vaccine distribution. So they are using a rotating bevy of hospitals designated under their regions for emergency preparedness planning. Region A is the region that encompasses Kansas City metropolitan area. Long story short, they've designated hospitals that will receive the shipments that Missouri has coming in for every other week shipments. So Truman, North Kansas City, and Liberty are in week 1. Week 2 would be the St. Luke's and HCA facilities primarily. But much as John has really stressed, it's all about supply. Because these facilities will be getting about 10,000 total doses for the metropolitan area. And they all, in their early communications with state officials, were saying, look, we can do 5,000, 6,000 patients a day in our clinic settings. We're happy to take on about 20,000 doses. Well, that just doesn't exist in the metropolitan area. So kind of where I'm going with all of that is in the grand scheme of things, people are ready to stand up clinics. The wherewithal is there. One of the big issues is the lag in terms of data entry on kind of reconciling shots being given and the perception that it's not out there. So I know there's a lot of discussion amongst providers about trying to figure out the best way to get that information shared. And then there's been some other little nuances that have been shared that many times the staff vaccines that were given do not live in a normal EMR or electronic health record. They actually were living in other tools that were used to track staff. And so that information was harder and slower to get collected and reported. It may explain some of these lags where it looks like vaccines still sitting on shelves, not being distributed. Simply, that is not the case. And I think all providers are really trying hard to get that in there. The other thing is I think the providers are working diligently to maintain integrity with the criteria for those that are in the queue, and at the same time assure that there's no wastage. When you get to the end of the day and you've got doses in the vial, you're going to see hospitals, try and find those in the queue that they can to get vaccinated. But I think a lot of them are also being the stewards and saying, we've got to get it into somebody's arm. Let's get that done instead of just throwing it down the biohazard sink at the end of the day, so to speak. So long story short is it's a complex logistical challenge. It's much slower than a traditional vaccine process because of the waiting, the waiting period after receiving the shot, the social distancing, all of those things that just, fundamentally slows it down when you look at it and you say, well, we do this every year with the flu vaccine. Well, yes, you do, but you just get it and you leave. And you don't worry about being within 6 feet of the person in front of you, and so on and so forth. So again, the process or not change, the reality of the process for vaccines like this really complicate delivery, but it's being done pretty efficiently and steadily. And then on to the data like John shared, everybody's experiencing that downward trend. I think everybody's also a little bit nervous about if we have any one of these variants take hold and begin to spread rapidly. The genetic testing that I've been aware of has not yet identified any of the variant strains in the metropolitan region, and that may give us a little bit of cushion. And then if you just start to think about simple mathematics, right? The number of people infected, the number of people vaccinated, the number of people still potentially susceptible, the spread is going to naturally begin to slow down. We're nowhere near herd immunity, but there's enough buffers in there that it's beginning to slow down from its peaks. Again, all presupposing we don't see one of the variants explode. So Kenny, I'll give it back to you to chime in from there.
Yeah, so thank you, Bryant. And I would just say ditto to all the data that's been shown, and that is really, it's really good news for all of us. We certainly are experiencing it. And I'm Kenny Wook, the University of Kansas Health System. We're experiencing that. We know that most of the hospitals across the metropolitan area are, and as John stated, I believe they are across the state. There's just a couple of points I'd like to add. So first of all, for everyone, no matter how much you've done, we want to say thank you for all the efforts that's been put forth, particularly the last couple of months. This is the outcome we were hoping, that we would peak and then start a steady decline. That appears to be the case. A little too early to get, we're not popping the corks on anything, but certainly the numbers are going in the right direction. And we recognize in the hospital world, there's been a lot of people outside the hospital that have helped to make that happen. So thank you. And second, John, we want to share with everybody to continue to keep it up. Let's be diligent. Now is not the time to let down your guard. That practicing the pillars of infection prevention are still paramount of importance. Please continue to do that. Please, follow all the guidelines. We're going to get through this. The vaccine, we're like everyone else. It's really is a supply side, but we have reason to believe in the weeks ahead that's going to tick up. So we can continue on this track. We hope things continue to get better, and at some point later in 2021, we'll be back to some form of our new normal, whatever that might be.
Thank you, gentlemen. Let me ask one question too, just because I have heard this. So Kansas gets some vaccine, Missouri gets some vaccine. Are people generally getting vaccinated on their side of the state line, or how's that working?
I think that's generally the case. There are some, I am aware of patients on the Kansas side that maybe have a provider on the Missouri side that have gotten some vaccinations over there, and vice versa. There's some patients that have gotten some shots that live in Missouri but get their care in Kansas. The federal government cares less about that. The state government obviously does care. We don't know how close that is to a wash, but that is an issue, and that's something we're very cognizant of and trying to work through carefully, John.
And what we did for a lot of the health departments for the clinics is the requirement was to work or live in Johnson County, for us. And so trying to get those healthcare providers that we know are in our community every day.
And Steve, are you guys focused on 65 and over right now? Is that how Johnson County is approaching this? Or are you doing everybody in phase 2? Is there a priority list that way?
So initially we went with 80 plus. Again, I mentioned we had 95,000 people over the age of 65 with less than 7,000 doses to get there. So we had to do some sub-prioritization. We do hope to go into the 65 plus range, hopefully very soon.
Okay. Yeah, I think we're still 80 plus in Sedgwick County right now as we're working through it. Okay, we got Dr. Watson, one of our favorite regulars, here with us. I'll give him the comm here so that he can share his screen. If you want to unmute yourself, Dr. Watson, and give us an update on the transfer situation and what you're seeing.
Yeah, great. And thanks. Really, this week, again, more of what we expect with more capacity across the state. And I do think it's interesting because there was a little bit of an uptick and then downtick in hospitalizations that have occurred over the last few days, even to the week. But because there is capacity in the system, it was absorbed, and we didn't see the level of desperation and sort of frantic behavior that can occur when things are really, really tight. The numbers keep trending correctly. 21%, 22% of the cases we're moving now are COVID positive, down from 40% certainly at the peak, and in the last few weeks 30%, with about a third of those looking for bed finding help. The times are really looking a lot better here. We're an hour 40 across the state, basically an hour if you're non-COVID. And the numbers just look a whole lot better everywhere we're looking. So everything reflects the fact we have capacity. We're on a downward cycle here, and I do think we are right that the vaccine's going to add some punch to that, but still a slow burn here, and it'll be interesting to see what this levels out at. I don't think today I was in a discussion about what is going to be the background level of COVID cases now going in through the summer, and how does that look? Spring spike, what's that going to look like? And I think we're all trying to get a feel for that and what the demand on the system is going to be.
You want to take any guesses?
Honestly, I think we'll go down to where we're transporting between 5 and 10% will be COVID suspecteds, and we'll run a low census all through the summer. I think there'll be another fall spike. It just, hopefully both of these will be blunted, and certainly if the vaccine stays true, even across a full season of change, if it doesn't genetically alter enough to become problematic, then we'll be ahead of it. If we've got to redevelop another vaccine in short order to try to account for a fall spike, we're going to be back to square one here with what's happened. But that would be Dr. Watson's guess.
That's good. We appreciate it. So any final comments any of you guys want to make before I wrap it up here? Steve, Bryant, Kenny?
Well, just I know we're going to go to every other week here, and I think that's the right call. But big shout out to you, John. You put a lot of energy and effort into this, and you brought a real positive approach to it. So thank you on behalf of all of us here in the metropolitan area. A big shout out to you. Thanks.
I appreciate it. I'm glad you can speak for everybody in the metropolitan area. That's quite a position to be in.
So
I'm just kidding.
I'm not going to get an argument on sending out a big thank you to you.
Hey, you're full of gratitude, and it's good to have optimism right now. Things are headed in the right direction. I'll reiterate, not the right time to let up, and still a good time to get the vaccine when it's your turn. It is a supply issue, and we're hopeful over time that supply will increase, and there will be more, hopefully, vaccines that come online actually too, beyond just Pfizer and Moderna. We'll be back in 2 weeks. I encourage you, after listening to this, go to covid.ks.gov/report-outs if you haven't already. Sign up for the email so you get the call the next time it's up. February 16th, March 2nd. We like to end on bright spots. I know everybody in the KC Metro knows what to think about for this week. Go Chiefs, get the red going. Got a great story. 2 Kansas City born and bred nurses who are nurses in Tampa got drawn to be free in the Super Bowl. They're doing, I think, 7,500 vaccinated healthcare workers. And so there'll be some Chiefs fans there going for the repeat. So there you go. How's that for a bright spot? Vaccinated healthcare workers getting to cheer on the Chiefs. Doesn't get more bright than that. All right, guys. Everybody have a great week. Thanks for your time today, and we'll see you in 2 weeks.
Thank you.